average American consumes nearly 70 pounds of added sugars each year without even knowing it.
Can you imagine?
In adults, this has been linked to obesity, diabetes, cancer, high blood pressure, metabolic syndrome, and small intestinal bacterial overgrowth. It may even play a role in food allergies, autoimmune diseases, irritable bowel syndrome, and behavioral issues. In children, moderate evidence indicates a relationship between all these sugars and an increased risk of cavities. Some studies also show they increase the risk of childhood obesity by 55%. Because all of this, medical and public health fields are really cracking down on added sugars in our diet. The USDA has found that Americans age 1 and older are eating too much sugar, fat, and sodium, and not enough dairy, fruits, vegetables, or oils in their diet. One of the areas we struggle most with is added sugars. The 2015 to 2020 USDA guidelines recommends healthy eating patterns with added sugars accounting for less than 10% of our daily calories. The American Heart Association recommends that adults try to limit them to about 25 grams for women, 36 grams for men. For kids, they recommend setting that limit at 12 to 25 grams per day depending on the child's size. That's 3 to 6 teaspoons.
But when we say added sugars, what exactly do we mean?
Added sugar is the extra sugar that isn't naturally in our food. Fruits, vegetables, and dairy products, for example, all naturally have some sugar, and those sugars are okay. What we are talking about is the sugar added during processing or baking to make things sweet. Drinks, yogurts, ice cream, cake, you get the idea. Up to 3/4 of our packaged foods have added sugars. These include table sugar, syrups, and other caloric sweeteners and are noted on labels by all sorts of different names. Be careful about honey and maple syrup. While they are natural, they still count as added sugars. The main reason added sugars are a problem is that they load our food with far more calories than it would have naturally, with no real benefit. In fact, excess sugar is turned into fat.
But how do we translate this for practical eating and address childhood and adolescent nutrition needs?
Discuss with your provider and dietitian how you can meet these goals. When juices are consumed, the AAP recommends they should be limited to 4 to 6 ounces of 100% juice without added sugars. In the kitchen, the American Heart Association suggests baking with 30 to 50% less sugar in recipes might not affect taste too much. Substitute unsweetened applesauce for sugar in recipes. Use extracts, almond, vanilla, orange, and lemon in recipes for enhanced taste. Add fresh or dried fruits to cereal, porridge, or oatmeal. Know that children between 4 to 13 years of age are most at risk for a rapid rise in added sugar intake. Some sugars are hiding in plain sight. Flavored yogurts can add up to 30 grams of sugar or more. 1 tablespoon of ketchup or barbecue sauce may contain a teaspoon of sugar. We should also identify the major sources of added sugar in a typical diet and target those. Sweetened beverages account for half the intake. Snacks and sweets account for around 1/3 of the intake. So these two alone account for 80%. Reduce these and you are near to achieving your goal. So that's it. Added sugars can adversely affect our health. Children over the age of 4 are most at risk for rapid rise in added sugar intake. There are many practical strategies to decrease intake of added sugars while still enjoying our food. Thanks for watching.